You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, Dr. Art Molzan, we've had him on the program before. He says nobody should be wearing a loose-fitting denture. He says you get a brand new set of teeth in just one day. With us, we have an expert on this topic. He's board certified in implant dentistry, Dr. Art Molzan. Dr. Molzan, welcome to the program. Welcome back.
Randy, thank you for inviting me back.
Now, I know you brought a lot of photos this time, so we'll try to get to as many of those as possible. But for people that don't know your practice, like who's the typical implant patient in your practice?
Randy, the typical implant patient, actually, they honestly fall into two groups.
Okay.
One group are folks who don't have teeth. Folks that are using removable teeth and for most of them, they aren't working very well. Particularly
the denture crowd.
The denture crowd. The
Okay.
denture crowd is one group. The second group is the group that we're helping the most. Those are the folks that we refer to who have gotten into the terminal dentition stage, meaning that they have loose teeth, they've lost bone, they're bleeding gums, they've got cavities, they've got a situation where it's not a question of whether we could save their teeth, it's a question of whether we should.
All right.
And many times the best option is not to save their teeth, to remove the teeth, place some dental implants, and give them a brand new set of teeth that looks great and allow them to function right away.
So how soon can they eat after the procedure?
Well, we just like with everything, there's a 2-week time frame where we ask them to go with very, very light foods. Subsequent to that, we put them on a fork diet for anywhere from 12 to 16 weeks. A fork diet is you take your fork, you turn it sideways. Anything you can cut with a fork, you can have.
So they could eat?
They can eat.
All right, and before you know it, they could eat whatever they want?
Yeah, and then they get into anything they want.
Now, people with bad teeth, and we've talked about this, you say they're judged. Maybe people think they're poor. Like in Hollywood, we talked about. You know, you want to make somebody look poor, first thing you do is mess up their teeth.
Correct.
So how important is a smile in your opinion?
Well, a smile. It's not just the smile, but the smile is the gateway to the soul in a way. They used to say it was the eyes. I believe it's the smile.
Okay.
It's how you represent yourself to the world. It's the one thing that people see immediately. They may see your hair color, they may see your shirt, and my goodness, we all spend money on jackets and ties and this and that, but the smile is the first thing that they truly see. And they do, unfortunately, it's probably not fair, but they do judge you on that smile. If you give them a big smile and your teeth don't look good, they're just not going to have the same opinion as if you do have great looking teeth.
You say it changes people's lives. That means you take people with really bad teeth or no teeth at all, give them their teeth back, and their life changes.
Yes, it does.
Is that an overstatement?
Yeah, it is not an overstatement, and we've got some stories that we can talk about in just
Let's
a short
show some
bit.
of the photos.
All right. So let me give you one right here of Jerry. In this case, Jerry was referred by his dentist. The good part about that is that he will be able to continue to work with his dentist after his teeth are completed.
So they don't have to switch dentists?
They don't have to switch dentists. And I think that's just a great advantage of our program, and that we do the teeth and we do the implants and we do everything in one setting in one afternoon. So because of that, these patients can get back with their dentist for their regular hygiene and things like that, and it just works. They still have their connection to their dentist.
Now, a guy with teeth this bad, one of his options, so you couldn't save those teeth, that would have been dentures. Is that right?
Correct.
Like this guy would have
Correct.
got dentures.
Yeah, and removable teeth are not the answer. They don't function, they don't feel.
Now, a guy like this, with his teeth, I mean, that's got to be unusual to see something like this. I mean, it looks pretty bad.
Well, you know, actually it's not, and that's the interesting part. As a dentist, for a patient, they think that's the worst thing that there ever was. But for a dentist, no. This is stuff we see every day. People don't see it because these folks are not smiling.
Okay.
They're not.
So there's a
not
lot
showing.
of this out there, you're saying?
There's a lot of this out there.
They just don't smile.
They just don't smile.
Yeah, so they look like mad or angry or whatever the case
They do.
may be. So this is a guy like, he's in pain probably too? Like
It
toothaches?
varies. You know, usually something will trigger someone to come in. They've got problems, but they've kind of kicked the can down the road, and usually something, a broken tooth, an infection, a swelling, a toothache, something will trigger the event, and that's when we get to help them. And this is Jerry 2 weeks later. First, I want to say it's already changing him.
Okay.
He's already shaved. He's already cleaning up. He had a mustache covering his teeth, doing everything to hide those teeth. He's already begun the process at 2 weeks to reshape his life.
And those don't come out.
And those do not come out.
Now, we should mention, insurance doesn't cover, I mean, even the best dental insurance doesn't cover the whole thing. Medicare, Medicaid doesn't cover it.
Correct. And they don't, and I don't believe in the near future they will. But we've got some innovative financing programs available.
Are people doing that? They're financing
Absolutely.
it? Like every day they finance?
I'd say the majority of our patients involve some level of financing. If they've got good credit,
So
they've got to have good credit, but we can involve them in some level of financing so that they can work in their budget, because it is a big investment. That's the truth. It's a big investment, and they have to find a way to make it work within their budget. And the financing programs work very, very well in accomplishing that. And with Jerry, it's one visit, one afternoon, teeth out, implants in, new teeth there. He's done. He looks in a mirror. His life has changed. I mean, there are opportunities for people when they have problems to do nothing.
What about the people that are afraid?
Oh, everyone's afraid of the dentist. There's no one individual who doesn't have a concern about the dentist.
All right, yeah.
So by packaging their care and doing everything in one visit, we sedate the patient. They don't remember being at the office.
Like very little.
And very little. Most don't remember hardly anything at all.
Okay.
And then they get home, they look in a mirror, and they've got teeth. And they're nice looking teeth.
Okay.
So with these things, I mean, these patients have an opportunity when they have a choice. They can do nothing. But if they do nothing, nothing changes. Or they can do something and maybe change their life. Let me give you this one.
All right.
All right. This is Dave. Had a partial, was unhappy with it, teeth broke.
Okay.
So another one of these patients where you look at them and you talk about it and you go, what's in his best interest? Where should we go? Is this a case where we should be saving teeth? Or is this a case where maybe if we can combine the care, do everything in one visit, and give them a brand new set of teeth in an afternoon? Is that a better way to go? And so as I've evolved over the years, we find that approach is working more and more often for people. Fixing one tooth at a time. If all they need is one tooth at a time, that's the right way to go. And our office is complete care. I mean, we fix one tooth at a time if that's appropriate.
Okay.
But the vast majority of what we do is taking care of the whole patient.
So you couldn't save those teeth?
No.
Okay. So his option was a denture.
Removable denture.
Like, do they say, like, I don't want a denture? I mean, that's why they go to you, right?
I don't think I've ever had someone say, I want a denture.
Okay, yeah. Okay.
I mean, it's the last thing. But many of my patients have been told that's what they need. That's their only option. And that's not the case.
Okay.
With this new stuff, we can actually accomplish in a single visit.
Let me see his after.
All right.
Wow, not even the same guy.
To me, it's unbelievable. He looks younger.
Yeah, that's true.
He looks healthier. He's more robust. He's shaved his beard. He's
more handsome.
He's more handsome. He's got more hair. I don't know how it works, but something's going on there that it's just amazing. All right, so what I want to talk about is in that smile, a more youthful smile is not worn down. As we mature in age, our teeth tend to wear. This smile is a youthful smile. If you look at the two front teeth, they're just slightly longer than the teeth next to them. Plus, then you see the eye teeth, the pointed eye teeth. That's a sign.
Those are the canines?
That's the canine teeth, and those are the eye teeth that give the smile the look. It lays right across that lower lip, which is again another youthful smile.
I mean, he does look younger from it.
Yes.
So when he sees himself, because this is a big difference.
Yes.
What do they say?
Well, that's in doing what I've been doing now. The exciting part is we're doing smiles. I understand that, but we're doing more than smiles. It's reflected in their whole life. I now realize, having done this for 20 years plus, that we're changing people's lives. We're not just fixing smiles and just fixing teeth.
Okay.
It's a whole new opportunity
so they
for
act
these
differently,
patients.
You say, like when they come in for their cleanings or whatever.
They're happy. Just for lack of any other better term, they're happy. It's a happy thing. Let me give you a picture of Cliff. Cliff hurt his teeth and then subsequently developed some bone loss around his teeth. And I want to make one point clear. A lot of dentists historically have blamed patients for not taking care of their teeth, and that's why they have the problems.
Okay.
New studies have indicated that that's not true. We know that genetics play a major role in whether someone loses bone around their teeth. And so patients should not feel bad that they've developed a bone problem or a gum loss problem or a gum problem, because it's not necessarily their fault. It could
Like it's an infection in their mouth.
It's an
Can't
infection.
brush and floss that infection
You can't get it out. You got to do something different.
Okay. So he's too young to be wearing a denture.
He's absolutely too young to be wearing a denture, but everybody's too young to be wearing a denture. A denture is a handicap. There's no reason in today's world that these things can't be done and worked out. Even under the most adverse medical conditions that patients have, we're still able to help them. So it's been a wonderful thing. In his case, the top ones were fixed, new teeth on top. The bottom ones we fixed with laser therapy. We went ahead.
So you saved those teeth.
We saved his bottom teeth and got him healthy. So, I mean, at his age, he's got a long road ahead of him, and he ought to be able to smile and chew comfortably. It just compliments him. He was a good-looking guy before. He's just a little bit better-looking guy now. And if you look at the eyes kind of tell the story. He's just a happy guy, and delighted, probably just to have it all done, but nevertheless.
So he can eat whatever he wants. I know I've said this before, but I mean, like chewy things.
Yep.
Like nuts.
Anything.
Really.
We take the bridle off. There is no restriction.
So Dr. Molzan, we're going to take a quick break. When we come back, a little bit more about the process and what they can expect on day one. You're watching the Wellness Hour. We're talking about replacing missing teeth with dental implants. No more dentures. We'll be right back.
No more dentures. No more floating dentures. No more glue in dentures. We can give you teeth that go in your mouth, that stay in your mouth, that you brush and clean just like normal teeth.
You don't have to worry about what you're going to order if you go out. You can have anything.
Get out there and enjoy life. You can go out and go wherever you want to go, to restaurants or out with your friends to eat, and you can smile.
We have all the materials necessary to do these procedures, including financing. Make the call. Change your life.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have an expert on the topic. He's board certified in implant dentistry, Dr. Art Molzan. Dr. Molzan, I know you have a stack of photos, and we're a little bit short on time. So
Okay.
What else do we have here?
Well, let's go. Let's talk about Olga.
Pretty good teeth. I mean, they look good.
Okay. She presented with a toothache in the upper. That, again, usually something triggers them to come in.
Okay.
Because they've managed to kick that can down the road and not do anything. So in Olga's case, she had a toothache. And what we're able to do is use our brand new CT machine, where one picture does everything. So it's a simple 20-second device that tells me everything that's going on. Well, in Olga's case, what we found was a bunch of root canals that had gone bad.
Okay.
So it was a classic teeth in a day type concept, where the teeth were removed, implants placed, and a brand new set of teeth put on top. And in her case, it was more important than most. She had a history of diabetes, and diabetes and dental infections do not go together. They're inconsistent. So you do not want to, especially diabetics, don't want to have infections. None of us want to have infections. If you look at her preliminary smile, it's the before. It's pretty nice, okay? But if you go to the after, totally different.
Yeah.
It's got that curve to it, that feminine curve that gives her that youthful look. In fact, she said, when we called her the other day to make sure she'd let us use her picture, she says, I really like the way I really like my new face. Didn't say anything about her teeth. I really like my new face. I mean, it's not just the smile, it's not just the teeth, it encompasses the entire package. Yeah, I just love the smile. I mean, it's the eye teeth right where they're supposed to be, front teeth down, a little bit sexy there. I think no, it's a youthful smile, and it generates all the way through their face, and you can see it. She was a happy gal here. She's a little happier there. Next patient is next friend / patient. I want to also say, I can't thank these patients enough for letting us utilize their before and afters. These are my favorite patients, every one of them. They're great. I just have to thank them. So this Marty had broke a tooth, had some other problems in the back, came into the office. It was a big investment for him, and like we said, Medicare doesn't cover it. So a lot of times we've got to look at different ways and find different ways to help them accomplish this stuff. But we know that, and he came in from the TV show, by the way. I didn't know if I mentioned that. He came in from the TV show and couldn't believe it could happen. Didn't believe it was possible.
So skeptical still.
Very skeptical. In fact,
Because he
as
was
we
had
go
to do a
through-
denture, is that correct?
Well,
Like couldn't save those
He
teeth?
didn't know.
Okay.
That's most of these patients have that fear in the back of their mind that their only choice now is a denture.
So he sees you on TV. I'm
He
sorry, I
sees us on
interrupted.
TV. We offer the free consultation to come in, and that's the big thing. It's like, how do you take that next step? It's hard for many of them to take that next step, to come in.
Especially men, right? We put everything off till we're in pain.
Well, also they're afraid of what the answer is going to be.
Okay.
They don't want to. They're afraid that it's going to be a denture.
All right.
And they know that that's not good. They've had parents, they've had friends, they've got people where those removable devices are not working. And so, in his case, he knew it was a big investment, but he also knew that having bad teeth was not good. I mean, Harvard has shown that someone who has a healthy mouth with good, healthy teeth or healthy implants can live 10 years longer.
Okay.
That's big, especially if they're fun years.
So because of digestion and eating better foods
the
and
whole
fiber
thing,
and all
it's the
those
way
things.
they feel about themselves, the social interaction. It's not just functionality.
But if you have bad gums, like gum disease, gums are too bad to do this?
No, in fact, those are the patients we see.
All right.
I mean, if we didn't have patients coming in with bad gums, I don't know what we would do. So
Okay.
part of the treatment is to clean everything up. Now, a couple of patients I've already shown you, we remove some teeth and we replace them with implants and solid teeth. But a couple of those patients and some of these future ones are the same thing. We cleaned up their teeth. We made them healthy again, and the gums respond. The gums come
Okay.
back, and
All
they
right.
and they get healthy.
Yeah, but what about people that have been wearing dentures like 20 years? Not enough bone to get this done.
Well, that's the most exciting part about what we're doing now. We're finding new, innovative ways to work with less. As I've done hundreds of these cases now, we're now going forth and doing things that we thought were impossible before. I trained with Dr. Malo, the inventor of the entire immediate system over in Portugal last summer, and they're coming out with just more and more and more innovative ways for us to help people who have less.
So have you ever had to turn anybody away because they didn't have enough bone?
We have not.
Okay.
Not today.
So that's not an excuse anymore.
That's not an excuse.
So look at this guy. He's looking good. Wow.
If you notice, he still hasn't developed his new smile yet. As
does that
time
mean?
goes by, what you're going to see is that grimace is going to disappear, and he's going to come up with a normal lip smile.
So he's not used to smiling, is what you're
Most
saying?
people are not used to smiling, and that's one of the things that I feel so bad about, that many of these patients have gone 10, 15 years without smiling. You know, life is only so long, and to take that 20% segment, 25% of life and not smile, goodness gracious,
yeah.
let's say it's not good.
It's good.
Okay, let me show you a picture of Larry.
All right.
Now, Larry had his teeth removed and had removable teeth. They didn't work.
Like
had a
false
couple-
teeth. He had dentures.
Had
Okay.
false teeth, had a couple sets made, didn't work. Wanted something better. Okay, so in Larry's case, Larry comes from far away. It's well over an hour drive.
How did he hear about you?
Actually, in his case, he heard about us through the TV show.
Okay.
Okay, and of course, like many of our patients, almost all of our patients, they can't believe it works. They can't believe that this can happen. That
Like it
within-
sounds too good to be true in their
It's
mind?
too good to be true. Absolutely.
All right.
Yeah, and so for Larry, very important to have this done in one visit, few visits, because he's driving a long way. And so in his case, I think Larry's change is off the chart. He changed from a geriatric type guy to a young guy.
my
And the only
goodness.
thing he demanded was that I put him on TV.
He said, I want to be on that next interview.
I want to be on that next show. Okay? But if you look at it, it doesn't look like the same guy. I mean, he's
No.
lit up. That's an amazing change. I mean,
His hair looks better.
everything looks better.
All right.
He's
And he can
a-
eat whatever.
He can eat whatever. He's a younger guy.
I mean, do they tell you, like, can I eat a steak? I mean, are they even worried a little bit at the beginning of what they could eat?
They're all worried because we restrict them for the healing time. So they've got that fork diet thing that we talked about, where they have to use a lot of common sense during the healing phase. But once we finalize the teeth and turn them loose, it's unrestricted. So we've got Bob. This is a great guy. He invested a lot of time and money in saving his teeth and just couldn't do it. Had a heavy bite and teeth just kept breaking. So the interesting part was that we couldn't save the teeth. we decided not to save the teeth together. And in that, we removed his teeth, did the implants, had new teeth. But we had to finish his teeth very rapidly because he was leaving. Randy, have you heard of the running of the bulls in Pamplona, Spain?
Yes.
It's where they turn the bulls loose, they run down the street, and then they put a bunch of people in front of them with white outfits and red sashes, and they wave their hands and go crazy. Well, Bob was leaving the next day to run with the bulls. And his biggest fear was that he had removable teeth, they'd fly out during the run, and he'd lose his teeth.
Okay.
So Bob the next day was running with the bulls in Pamplona.
With his new teeth.
With his new teeth. Unbelievable.
Let's take a look at the
guy,
after.
What a guy. And what for him, he called us yesterday, he'd just gotten back, and he said the interesting part was a lot of the Spanish women thought he was a movie star.
Because of his teeth.
Because of his new teeth. How's that?
Looks nice.
I mean, he's happy. That's a happy guy. When someone says you're a movie star,
okay.
we've done things right.
I don't want to rush you, but we probably have time for maybe one or two more.
Okay, well, let me go fast then. We'll go quick.
Okay.
So here's Joyce. Troubled teeth, some bone loss, but very unhappy with her smile. Couldn't whiten them, couldn't give her the smile that she wanted. And for Joyce, we have a rating system of how scared people are. And Joyce circled the 10 over 10, which is the most anxious you have. And then she put a bunch of plus signs.
So like a phobia.
She was off the charts. So without sedation, you would have I don't think you could treat her. And treating her one tooth at a time just made 0 sense. So we slipped the top teeth out, implants in, new teeth. And I mean, I think it's a different gal.
Wow.
And the more fun part is, we called again to ask if we could use her pictures, and she said, well, I'm coming in next week, I want a new picture, I look even better.
Okay.
So just about that smile, that lip is starting to reform to the new teeth, and she feels, and that's what's important, she feels she's looking better.
What do they like more? Do they like the fact that they can eat whatever they want, or do they like the way it looks? Or is it a combination of both?
I think it's more that, okay, the best way to language that is when I have people who have a denture and they come in, they need something done, adjustments, usually all the time, but they'll say, my denture is not working. Something's not there. When these patients come in and they need something done, whatever it may be, they go, my teeth. It's their teeth. It's their teeth. It's part of their body. It's just like, it's them. It's not an artificial prosthesis or
So they
whatever.
maintain them just like regular teeth. They go to the dentist like every 6 months, get them cleaned.
Yep.
Okay, good.
Okay. Let's go to Judith. Again, responded to the TV show. She had the mini implants where her teeth locked in, but many times
Like a snap in, snap out.
Like a snap in, snap out. And the problem is with many of those, it works for a lot of people, but you still have removable teeth. You still have teeth.
Like maintenance, things like that.
Yeah, you still have teeth that go in and out every day. You've got to take your teeth out and brush them. Nobody wants to take their teeth out and brush them for fear someone's going to walk in the bathroom on them and they're going to be found with no teeth, because no teeth, you look 10, 20 years older. I mean, you just get that yucky look. Okay, so we removed the minis, we placed implants, gave her a brand new set of teeth, top and bottom. And with Judith, I love the smile. She's just lit up. It looks like a different person. But with her, we use some of the new Novocaines, and the new Novocaines can last anywhere from 2 to 4 days. They have zero discomfort for 2 to 4 days. It's unbelievable. So what I want to point out is, with the new advances in medications and medicines and things, all patients fear having discomfort during the procedure and after.
All right.
With the new medications, with sedation, we can make the experience where they don't have discomfort.
Okay, or very little discomfort.
Very little. Yeah, there's always a little bit. Okay, here we go.
All right.
This is Debbie.
Now, you told me you want to make sure we show this person, so you must really like this one.
We definitely want to show this one. She had just given us a call to okay it, and she had lost some bone, teeth were spreading out, she had an infection. Again, something triggers coming into the office. And so She was a 10 out of 10 on the chart again. She put the pluses on the
Afraid of the dentist.
afraid of the dentist.
Okay.
And so when those patients are there, who have a terminal dentition, they're not the ones that you
When
want
you
to do.
call a terminal dentition, that means that they're eventually going to lose all their teeth.
They're at the end of the road.
Okay,
The
okay.
end of the road. That's all it means. And so we were able to do give her teeth and everything, top and bottom with one
In
visit.
one afternoon.
One
kind of
afternoon.
thing.
And here she is.
Gee.
And she is absolutely one of our happiest patients. She has a glow. She had a glow before, but now she's really got a glow. I mean,
You know, look.
somehow her glasses look different. I don't even know what it is.
We talked on the phone, and I felt like you were exaggerating. You said, Randy, because I'm skeptical. You know, it's like you say it really changes their appearance. And I think anybody at home watching this, I mean, it's a complete different look.
Well,
Now, why is
and
it-
I have to say that part of it is our lab resources, because all of these teeth are customized through photographs and the artisan doing the technician work. Uli is
Does it cost more,
fantastic.
though? Because there's a lot of people in this business, but does it cost more to get like the art, like the cosmetic dentistry part of it that you're doing?
No, and the advantage for us is we take them from the beginning to the end. I do all the work, everything. So
right.
we know what they look like at the beginning. We know what they want to look like at the end, utilizing photographs and again a great
What does she say? I mean,
laboratory.
because this is like an extreme makeover. What does she say?
Oh, it's unbelievable. No, she says I want to come back in and have another picture taken. It's just.
We are out of time.
Okay.
Final message. Somebody watching this at home, they fit into one of the two categories that you mentioned, which is their teeth are bad, and maybe they're going to end up in dentures. They're worried about it. That's one group. The other group is the denture wear.
Correct.
But they've heard you maybe. Maybe they've seen you on TV before. But for whatever reason, they're still afraid or skeptical or whatever. What do you say to them?
You got to come in and find out your options. Historically, good things, you remember the saying, good things come to those who wait?
Yeah.
That's old news. Now, it's do something and change your life.
Is it like the third set of teeth?
It is like the third set of teeth. I hadn't thought of it that way. It is the third set of teeth. And this is a set that you get to help design. You don't. They don't just come to you. You get involved in and all of these patients are involved in that decision-making process. They tell us, we take them through various try-ins and things, so they get a chance to input how they want to look. We take photos, everything.
Good. So Medicare doesn't cover this really. Medicaid, best insurance, it covers a small portion, but you're financing, you
Correct.
offer, and they're doing it every day.
Yeah, our goal is to work it in their budget.
All right. Thanks again, Dr. Molzan.
Thank
Always
you, Randy.
A pleasure.
Love it.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.